Hello, Mr. and Mrs., Senator, Representative, whatever they are. My name is Lauren Muenchow. I'm really happy to be speaking with you as I have admired the work that you did on, and I would take the opportunity to talk about something they've done in the past. I recently started medical school at the University of Texas, Rio Grande Valley, which is located along the Mexican border. I was ecstatic to get in. I would have been to any program, but this program in particular really intrigues me because of the opportunity it had to go and work in a community that really seemed to need healthcare. And since I've been here, I have not been disappointed. There are definitely healthcare issues. The most shocking one for me has been the diabetes epidemic in the area. The rate of diabetes in the Rio Grande Valley is 20% higher than the rest of Texas. The CDC estimates that 1.3 million people in the valley have diabetes. That comes out to about 1 in 3. The valley is spending $1.5 million a year just treating this one disease. And that's crazy when you think that this disease pattern could be improved with simple changes in lifestyle. There are significant health issues in the Rio Grande Valley, yet many people here are without access to basic health care. Individual health affects public health, and this is evident in the area, which not only holds the highest rates for diabetes, but also cervical cancer and the most obese children in the nation. In addition to the shorter lifespan and lower quality of life the residents here have, there is significant economic toll that these health issues take on the area. Many people make trips to the emergency department at late or complicated stages of their disease. Employers lose money when people miss work days due to being ill. And there's many people down here who just aren't productive workers because of their chronic conditions. The health issues of the region are definitely linked with the economic issues of the area. The Rio Grande Valley has 11 of the lowest 100 annual median household incomes and 2 of the top 10 least educated cities in America. Unfortunately, it's really hard to make healthcare changes and change health education in an area where you don't have money to spend on educators. And I think that's why these issues in the valley have just persisted for so long. Fortunately, there is a healthcare program that provides education and improves health outcome at very efficient costs. Promotoras are community healthcare workers who go out into the community and offer education about nutrition, diabetes, mental health, as well as how to access doctors, the need for parks, safer communities, and more civic engagement. They are members of the communities, and therefore they share the same language, culture, traditions, and values as the residents, which really helps them make really great connections. And they engage with people who otherwise would not be reached. Promotoras are everyday people, they're mostly women, who go through a training process of at least 160 hours. They oftentimes work for little to no pay. They are assigned to community centers and usually are sent to the same areas, and they work with the same people for years. They've really established true rapport. Rather than target communities, they know how to enter these areas with respect and understanding and therefore make significant changes. While promotoras are focused on health, they realize there are many factors that influence health, and therefore they focus on overall wellness with each of their families. Not only do they improve the lives of the people they are working with, they save taxpayers money by intervening on health issues before they get worse and are more difficult to fix. Sadly, the Promotor program has lost funding, and many of the programs down here have dissolved. They're unable to keep communication with the families that need help, and they're unable to reach new families. This program has the opportunity to intercede in the dangerous circle that's been plaguing the valley of low education and low health rates. And I think it could really help the unhealthiest place in the United States make major changes at a minor cost. There is a bill on the table currently that would bring funding to the Promotora programs, and I would appreciate if you would look into it more. I have this sheet of references that match some of the statistics that I've given you that you can find and look at yourself. I would happily provide you with more information on the program or connect you with anyone that you might want to talk to, community directors, promotoras, or families, so that you can hear from them yourselves. I really appreciate you taking the time to listen to me, and I hope we can move towards a healthier Texas.